You're watching your local news leader. This is WCIA 3 News at 6:30.
And I feel like Aetna knew in October during open enrollment, some of this had to be in the works.
Instead, Aetna Medicare patients were sold a health insurance plan based on an inflated directory of doctors. Many are actually not available. It's the latest fallout as affordable access to health care continues to decline in central Illinois.
Retired teachers are afraid a doctor will not be available when they need one the most, or they'll simply have to pay more to see one. Our Target 3 team told you about 3 weeks ago, Carle Hospital in Urbana cut ties with Aetna Medicare. Investigative reporter Renee Cooper joins us now. And Renee, this impact is going beyond the Champaign-Urbana community.
McLeod, that's right. And K through 12 teachers and college professors alike across the state spent decades-long careers paying into these plans, only to retire to find out they're out of luck. Now, we introduced you to Vicki Good. She's a retired teacher from Paxton Buckley Loda. On March 1st, she and a countless number of patients learned, on top of losing access to Carle Hospital and its doctors the first of the year, several Christie Clinic doctors were going to be out of network because of their relationship with Carle. Since then, patients have been in limbo.
I had called several doctors to find out if I could get in, and they all were Christie doctors. And even though they were in my provider book, when I would call, they would say, well, as of May 1st, they're going to be out of the network. So then I was left with, okay, who do I call? You know, and by the time, before I found a new doctor, then I got the letter that said my primary care physician was back in the network.
When we pressed Christie Clinic about that this week, they told us they, quote, believe their primary care doctors are all back in network with Aetna. Coverage for specialists, though, continues to be up in the air. They told me a set of, quote, less than 30 specialists continue to be evaluated, and patients who receive primary care services will be able to see their providers without interruption. Now, this is important because Christie Clinic's primary care providers here, they make up 2/3 of the available doctors all throughout Champaign-Urbana for patients who are listed in the directory Aetna mailed to Good upon request. I quickly realized, though, this entire directory is riddled with errors. We spent hours over several days calling through this list of doctors.
It's the Aetna Medicare HMO plan.
Only to find half of the options advertised to Champaign-Urbana patients weren't real. A few were actually specialists, like oncologists or cardiologists, not someone you'd see for a checkup. Others simply weren't taking new patients at all. And when we couldn't find them online, we drove to the doctor's offices. Places Aetna claimed are, anyway. This is supposedly the location of a Dr. Patel off University Avenue in Champaign. A receptionist at the dentist office next door says he's retired.
If something happens and I'm very ill, I'm not going to have the time or the energy or whatever it is that you need to make these phone calls and be told one thing and then be told another thing and that sort of thing. And I don't understand why Aetna is doing this to, you know, long-term customers.
Let's take a look at this again. I want to break it down a little bit better for you. Aetna says it covers the cost of 168 primary care doctors statewide. Now, 39 of those are available with the 10 miles of Good, and that's required by federal law. Now, half of those are actually real options, and that's including Christie Clinic doctors. And it's unclear how many were actually on this list before Carle dropped Aetna Medicare. Now, in March, Carle Public Relations only told us its Urbana Hospital would no longer be in network. Since then, we've learned it goes far beyond that, hitting patients in parts of central Illinois, in rural parts of central Illinois, and there, Carle is really the only option. Mike Rodabaugh is an Aetna Medicare patient in Toledo. He saw a Carle doctor in Mattoon for more than a decade and has used the walk-in clinic there regularly before finding out that, too, is all out of network. And that same directory I called through shows 0 of those 168 providers are available to Rodabaugh now. 2 were within that driving distance for him. He found this out the hard way. Mike Rodabaugh has been a Carle patient for more than 30 years. Then came March 18th. He made a scheduled trip to the clinic in Mattoon for blood work.
And the receptionist never said anything.
Less than a week later, he made the drive again.
I went in and seen the patient's accounts girl, and she said, could I see your card? I said, sure. And she said, oh, gosh. She said, you've already seen the doctor and stuff. I said, yeah. Got right in. here's the trouble. And said that Carl does not take Aetna insurance anymore.
That was the first notice Rodabaugh got, seemingly 3 months after his doctor and clinics fell out of network. Just this week, he got the bill, close to $500 owed out of pocket for an annual checkup and to draw his blood. Rodabaugh called Aetna, wondering what options he has now.
Doctors aren't very plentiful around this area.
Concluding his best bet is to switch his insurer, he called the Illinois Department of Central Management Services, or CMS. That's the state agency in charge of administering Medicare plans for state retirees.
And she says, yes, you need to either change doctors, or in October 1st of this year, you can elect a different insurance. I said, now wait a minute. You guys are supposed to have insurance for me.
Even if he makes the switch, he's stuck with his Aetna Medicare plan and without his doctor until January 2023.
Right now, I've got nothing, because you don't work someplace 23 years just for the fun of it, usually.
The very least they can do is be more open and transparent with what's going on.
State retirees in more than 40 counties rely on Aetna Medicare as one of 2 options for health insurance.
Aetna is definitely the lesser expensive between it and United Healthcare.
A portion of Vicki Good's retirement is subtracted each month to pay for that chosen plan, one that is not as advertised. In more than half of those 40 counties in blue, at least 25, Aetna doesn't have a single primary care doctor to see seniors. That's as listed in the statewide directory mailed to Good in March.
It makes me want to wonder why it's just happened to people 65 and older. It doesn't seem right.
At this point, do you have any idea what you'll do at open enrollment next year, or this year, I guess, later?
You know, I've given a lot of thought to that, and with all that's gone on with Aetna, I want to look into the United Healthcare and just see how much more expensive and all it might be.
Here's an update for you. Since I interviewed Rodabaugh, in the last day he was able to make an appointment with a doctor about 20 miles away at a Sarah Bush Lincoln clinic in Neoga. Now, she wasn't in the directory before that. So is Aetna's directory of doctors adequate under the law? State law requires 1 primary care provider per county, which we found Aetna sorely lacked. But Medicare plans are regulated by federal law, which doesn't go as far. There may be enough providers to satisfy that mandated patient-to-provider ratio in Cumberland County. That's where Rodabaugh lives. But Aetna refuses to release how many customers are on its plans in Illinois. Now, CMS tells us late today insurers must make a, quote, good faith effort to notify patients at least 30 days before breaking up with their doctor. I sent a very detailed list of questions to Aetna and Carl as well. I was given statements with little answer back. Those are going to be online. If you're a state retiree or rely on Aetna Medicare for affordable health care, we want to hear from you. Email us at target3@wcia.com. Back to you.
All right.